You've seen those two numbers on your blood pressure reading hundreds of times, written one above the other, mentioned casually at every doctor's visit, and then quickly forgotten as you went on with your day. But what almost no one ever explains clearly is that after the age of 61, of those numbers quietly becomes far more dangerous than the other. And focusing on the wrong one may cost seniors their independence, their memory, or even their life. I'm Dr. Eliza Hart, and for more than 15 years, I've worked closely with older adults, helping them understand how age-related changes affect blood pressure, circulation, and long-term cardiovascular health. One of the most common problems I see in people over 60 is not neglect, but confusion, especially when familiar numbers are misunderstood, and the most important warning sign is quietly ignored. If videos like this help you better understand your health, please subscribe to the channel and take a moment to comment the country you're watching from, so I can see how far this information is reaching across the world. And if you believe this channel brings real value, please help me reach my first 50,000 subscribers, so I have the motivation to continue growing this work. Please watch until the very end, because I have a small surprise related to this topic, and to understand why it matters, let's begin by clearly breaking down what those two blood pressure numbers mean and why they are not equally dangerous after 60. 1. Understanding blood pressure and which number is more dangerous after 60. Before we talk about risk or danger, we need to slow down and clearly define what blood pressure actually is, because many adults hear the term for decades without ever being shown how it works inside the body. Blood pressure describes the force of blood moving through your arteries as your heart pumps, and every time that cuff tightens around your arm, it is capturing how much pressure your circulation is placing on your blood vessels at two different moments of the heartbeat. Those two moments explain why every blood pressure reading comes with two numbers. The top number, called systolic pressure, measures the force created when the heart contracts and pushes blood forward into the arteries. The bottom number, known as diastolic pressure, reflects the pressure that remains in the arteries when the heart relaxes between beats. On paper, these numbers appear side by side, and for many years, people were taught to watch them, as if they carried equal meaning and equal risk. What changes after the age of 60 is not the definition of blood pressure, but the way the body responds to it. As we grow older, the structure of the arteries gradually changes due to long-term stress and natural wear. Healthy younger arteries are flexible and stretch slightly with each heartbeat, which helps absorb pressure and protect organs. With age, however, arteries become stiffer and less able to expand, altering how pressure is distributed through the body. Large long-term studies following older adults for decades have consistently shown that after 60, systolic pressure becomes a much stronger predictor of serious health outcomes than diastolic pressure. Stroke, heart failure, kidney disease, and vascular cognitive decline are all more closely linked to elevations in the top number, even when the bottom number remains within a range that appears reassuring. This is where many seniors become unintentionally misled. A normal or lower diastolic reading can create a sense of safety, while a slowly rising systolic number quietly signals increasing strain on blood vessels and vital organs. Understanding this distinction is the foundation for everything that follows, because once you see how differently these numbers behave with age, it becomes easier to understand why focusing on the wrong one can lead to very different real-world outcomes. 2. Two real cases, two very different outcomes. To understand why focusing on the wrong number can be so dangerous, it helps to step away from theory and look at how blood pressure plays out in real life, because it does not damage charts or guidelines, it damages people. Over the years, I've seen many adults arrive with similar readings but very different assumptions, and what happens next often depends on which number they were taught to watch. The first case involved a woman in her early 70s whose blood pressure consistently showed a high top number and a comfortably low bottom number. She was careful with her health, attended regular checkups, and felt reassured every time she saw that lower number stay within what she believed was a safe range. Because she felt well and her diastolic pressure looked good. The steadily rising systolic pressure was treated as a minor concern rather than a warning sign. Months later, she suffered a severe stroke that left her struggling with speech and mobility, the result of long-term strain on the blood vessels supplying her brain. The second case looked different on paper. This patient, a man in his late 60s, had a blood pressure reading where the bottom number was elevated while the top number remained closer to target. He was deeply worried, convinced that constant pressure during the heart's resting phase meant his heart was under severe stress. After a thorough evaluation, however, his heart structure, circulation, and overall risk profile told a much calmer story. His situation required attention and adjustment, but his immediate risk was far lower than he feared. What makes these cases important is the pattern they reveal. Many seniors feel reassured by a normal-looking diastolic number and underestimate the danger of a rising systolic pressure, while others become alarmed by the bottom number without understanding how age changes its meaning. In both situations, the emotional response is understandable, but the medical risk lies in how long the true problem is left unaddressed. In the first case, damage accumulated quietly over time, while in the second, fear outpaced actual threat. Together, they show how misreading blood pressure can either delay treatment or cause unnecessary anxiety, depending on which number receives attention. 3. Why systolic pressure increases with age. Many people assume rising blood pressure is simply the heart getting weaker with time, but in reality, the more important changes are happening in the blood vessels long before the heart shows any signs of struggle. In younger adults, arteries are naturally elastic, meaning they stretch slightly with each heartbeat and then gently recoil, which helps absorb part of the pressure surge and protect organs from sudden force. This flexibility acts like a shock absorber that smooths circulation with every beat. As the years pass, that elasticity gradually fades. The arterial wall undergoes structural remodeling, with elastic fibers breaking down and being replaced by stiffer collagen, while calcium deposits and long-standing inflammation further reduce flexibility. When arteries lose their ability to expand, the same heartbeat that once caused a gentle stretch now sends pressure directly forward. The result is a higher systolic reading, not because the heart suddenly became weaker or stronger, but because the vessels no longer soften the impact. What often confuses seniors is that this rise in systolic pressure can happen quietly. Diastolic pressure may stay the same or even decline, creating the impression that nothing serious is changing. In reality, stiff arteries do not recoil effectively during the resting phase of the heartbeat, so pressure patterns shift in a way that makes the top number climb, while the bottom number looks calm. This is why many people feel well and remain symptom-free even as systolic pressure steadily increases. From a clinical perspective, this process is not an abrupt event, but a slow progression influenced by age, long-term blood pressure exposure, metabolic health, and lifestyle factors accumulated over decades. That gradual nature is exactly what makes it dangerous, because damage builds long before discomfort ever appears. If this explanation helps you see your own readings differently, take a moment to engage with the video by commenting. 1. If you've noticed your top number rising over the years, or 0 if you've never paid much attention to it before. Your responses help guide future topics and show how many people are recognizing this pattern. Once you understand how aging arteries drive systolic pressure upward, the next step becomes unavoidable, because we need to look at what that sustained pressure actually does to the organs it reaches every single day. 4. What high systolic pressure damages in the body. When systolic pressure stays elevated, the damage it causes is rarely sudden or dramatic at first, which is why it is so often underestimated. But over time, that repeated force begins to affect the most delicate systems in the body. Every heartbeat sends a pressure wave forward, and when that wave is stronger than the arteries can safely absorb the organs at the far end of circulation, pay the price. The brain is one of the most vulnerable targets. Small blood vessels that supply brain tissue are not built to tolerate constant high pressure, and with prolonged exposure, they develop tiny areas of injury that accumulate quietly. These changes increase the risk of major strokes, as well as countless small, silent strokes that gradually impair memory concentration and processing speed. Many cases of age-related cognitive decline are closely tied to years of uncontrolled systolic pressure rather than sudden neurological events. The heart itself also suffers under sustained systolic strain. To push blood into stiff, high-pressure arteries, the heart muscle must contract with greater force, and over time it adapts by thickening. A thickened heart becomes less efficient and less flexible, making it harder to fill properly between beats and increasing the risk of heart failure and rhythm disturbances. The kidneys are another critical casualty. Each kidney contains millions of tiny filtering units supplied by fragile blood vessels. An elevated systolic pressure gradually damages these vessels, reducing their ability to filter waste and regulate fluid balance. As kidney function declines, blood pressure often rises further, creating a cycle that accelerates vascular and renal damage. What makes all of this particularly dangerous is that these changes develop slowly and without pain. Many seniors feel well and remain active while damage progresses beneath the surface. High systolic pressure is not simply a number on a monitor. It is a mechanical stress applied thousands of times each day to organs that were never designed to endure it long term. Once this pattern is understood, the focus naturally shifts from whether systolic pressure matters to how specific blood pressure patterns emerge in older adults, especially when the top number rises while the bottom number appears deceptively normal. 5. Isolated systolic hypertension. One of the most misunderstood blood pressure patterns in older adults is isolated systolic hypertension, partly because it does not fit the way many people were originally taught to think about hypertension. In this pattern, the top number rises above healthy limits, while the bottom number remains normal or slightly low, creating the impression that the situation is less serious than it truly is. For many years, this pattern was dismissed as a normal consequence of aging rather than a medical condition requiring attention. Seniors were often told that as long as the diastolic number looked acceptable, the higher systolic reading was something to tolerate rather than treat. We now know that this assumption was incorrect. Isolated systolic hypertension reflects significant changes in the arterial system, not a harmless shift that comes with age. As arteries stiffen over time, they lose the ability to cushion pressure generated with each heartbeat. Blood is pushed forward forcefully, driving systolic pressure upward, while reduced recoil during the resting phase prevents diastolic pressure from rising in parallel. The result is a widening gap between the two numbers, signaling increasing stress on blood vessels throughout the body, particularly in the brain, heart, and kidneys. Large clinical trials involving older adults have shown that untreated isolated systolic hypertension significantly increases the risk of stroke, heart failure, kidney disease, and cardiovascular death. These studies also demonstrated that treating this condition meaningfully reduces those risks. Lowering systolic pressure in seniors decreases stroke rates and improves long-term cardiovascular outcomes, even when diastolic pressure was never elevated. What makes isolated systolic hypertension especially dangerous is that it often develops without symptoms. Many people feel well and assume their blood pressure is controlled because one number appears normal. This false reassurance can delay treatment while vascular damage quietly accumulates. Clinically, this pattern is most often seen in adults over 65 who have otherwise stable health, which is why it is frequently overlooked during routine visits. Without careful interpretation, the warning signs can be missed for years, allowing pressure-related injury to progress unnoticed. Recognizing isolated systolic hypertension for what it is represents a critical shift in understanding blood pressure after 60. Once identified, the focus must move from whether it matters to how it can be managed safely. 6. Don't misunderstand diastolic and pulse pressure. As we focus more on systolic pressure after 60, it is important not to swing too far in the opposite direction and assume the bottom number no longer matters, because misunderstanding diastolic pressure can create a different kind of risk. Diastolic pressure reflects the pressure in your arteries when the heart relaxes between beats, and this resting phase plays a crucial role in supplying blood to vital organs, especially the heart itself. In older adults, diastolic pressure often stays stable or gradually declines as arteries stiffen. When it falls too low, particularly below the mid-60s, the heart muscle may not receive enough blood during its resting phase. This can lead to chest discomfort, reduced exercise tolerance, or subtle signs of strain even when the major arteries appear open and free of blockage. For some seniors, this explains why they feel lightheaded or fatigued, despite having acceptable blood pressure readings. Another concept that deserves attention is pulse pressure, which is the difference between systolic and diastolic numbers. A widening pulse pressure is not just a mathematical detail, it is a marker of arterial stiffness and vascular aging. The larger the gap, the more rigid the arteries have become, and the more force is transmitted directly to organs with each heartbeat, increasing cumulative stress over time. A wide pulse pressure has been associated with higher risks of cardiovascular events, cognitive decline, and overall mortality in older populations. It reflects long-standing changes in vessel structure rather than a temporary fluctuation, which is why it deserves clinical attention even when individual numbers appear borderline. This is where balance becomes critical. Very high systolic pressure damages organs through repeated force, while excessively low diastolic pressure can compromise blood flow during the heart's recovery phase. Both extremes carry risk, but they do not carry equal weight. When doctors must prioritize, especially after 60, controlling systolic pressure remains the primary goal while ensuring diastolic pressure does not fall to dangerously low levels. Understanding this balance helps prevent oversimplified thinking about blood pressure. It explains why one number cannot be viewed in isolation and why age changes how each component should be interpreted. With this clarity, we can now turn to what current medical guidelines recommend and how systolic pressure can be lowered safely and effectively in older adults. 7. Medical guidelines and how to lower systolic after 60. Once it becomes clear that systolic pressure carries the greatest long-term risk, after 60, the next logical question is what modern medicine actually recommends and how that number can be brought down safely without overcorrection. Current clinical guidelines are based on decades of large population studies, not short-term trends, and they reflect a much clearer understanding of how aging bodies respond to blood pressure control. Today, most major cardiovascular organizations define hypertension as a systolic reading of 130 or higher, and for adults over 60, controlling the top number is considered the primary target. For many healthy older adults, aiming for a systolic pressure below 130 has been shown to significantly reduce the risk of stroke, heart failure, and cardiovascular death. At the same time, guidelines emphasize flexibility because very frail seniors or those with multiple medical conditions may require slightly higher targets to avoid dizziness, falls, or reduced organ perfusion. The key point is that systolic pressure should never be ignored simply because diastolic pressure looks acceptable. Lowering systolic pressure usually begins with lifestyle adjustments, which form the foundation of any long-term plan. Reducing sodium intake, maintaining a healthy body weight, engaging in regular aerobic activity, moderating alcohol consumption, and managing chronic stress can collectively lower systolic readings by meaningful margins. These changes also improve arterial health over time, making the circulatory system more responsive to treatment. However, for many adults over 60, lifestyle changes alone are not enough. As arteries stiffen with age, medication often becomes necessary, and this should not be viewed as a failure. Blood pressure medications work by reducing vascular resistance, improving vessel relaxation, or lowering fluid volume, and many seniors require more than one medication to achieve stable systolic control. This approach is common, evidence-based, and often life-saving. Equally important is regular monitoring outside the clinic. Home blood pressure readings provide a more accurate picture of daily patterns, reveal hidden fluctuations, and help distinguish between temporary spikes and sustained elevation over time. With proper guidance and follow-up, systolic pressure can be lowered safely, steadily, and effectively, setting the stage for addressing the misconceptions that often prevent people from taking action in the first place and delaying care that could have protected their health earlier. 8. Common myths and what you should do. Even with clearer guidelines and better access to information, many seniors are still held back by persistent myths about blood pressure. And these misunderstandings often feel convincing because they have been repeated for decades. One of the most common beliefs is that rising blood pressure is simply a normal part of aging and not something worth treating aggressively. While age does influence blood vessels, allowing systolic pressure to remain high because it feels expected, exposes organs to preventable damage rather than protecting them. Another widespread myth is that feeling well means blood pressure cannot be causing harm. High systolic pressure rarely announces itself with pain or discomfort, which is why it is often called a silent problem. Many people remain active and independent while vascular injury quietly progresses beneath the surface. Waiting for warning signs usually means waiting until damage is already advanced. There is also confusion around family history. Some seniors believe that because a parent lived a long life with high blood pressure, treatment is unnecessary. This ignores the reality that many others suffered strokes, heart failure, or kidney disease that reduced both lifespan and quality of life. Another misconception is the fear that treating blood pressure will do more harm than good in older adults. While treatment must be individualized, large studies show that appropriate systolic control reduces strokes and cardiovascular events even in people well into their 70s and 80s. Once these myths are set aside, the path forward becomes clearer. Every senior should know their blood pressure numbers, track them over time, and focus on the systolic value rather than the bottom number alone. Readings should be taken calmly, recorded consistently, and reviewed as patterns rather than isolated measurements to avoid unnecessary worry or false reassurance. Discuss results openly with your doctor. Follow lifestyle guidance consistently, and use home monitoring to spot trends early. Most importantly, never assume that normal for my age means harmless. When outdated beliefs are replaced with accurate understanding, blood pressure becomes something you can actively manage. With that clarity, the final message comes into focus because knowing which number matters most after 60 gives you the chance to protect your health before irreversible damage takes hold. If you remember one thing from today, let it be this: after 60, the top number on your blood pressure. Reading your systolic pressure is the one most strongly linked to stroke, heart failure, kidney damage, and long-term memory decline. Diastolic still matters, but systolic is the number you and your doctor should prioritize controlling, especially if you have isolated systolic hypertension or a wide pulse pressure. Start simple this week by measuring at home for 7 days, cutting sodium from packaged foods, walking most days, managing stress, and taking any prescribed medication consistently, then bringing your home log to your next visit. If this video helped you and you'd like to support the channel, a small donation truly helps me keep making clear, evidence-based videos for seniors. Please like, share, and subscribe, and comment your country below so I can see where you're watching from. Thank you.